Hello, my name is Abigail Leithorn, and today I'll be talking to you about ethical decision-making in healthcare. What would healthcare look like without ethical standards? Well, healthcare professionals could put their needs, opinions, and beliefs before patients without consideration for their actions. There would be no moral standard of care to lead patient care and a disregard for many procedures that help keep a patient safe and healthy. While working in the healthcare field in various positions for at least 3 years, I can attest to the importance of maintaining ethical standards and implementing ethical decision-making in the health field. An overview of what we'll be talking today will be ethics and their role in healthcare, ethical dilemmas, why ethical decision-making is important, how to make ethical decisions, other considerations when making ethical decisions, and our conclusion. Before I can talk to you about how to make ethical decisions, it's important to understand what ethics are. According to legal and ethical issues for health professionals, ethics are the rules, standards, and moral principles that govern a person's behavior and on which the person bases his or her decisions. All medical care revolves around autonomy, beneficence, non-maleficence, and justice. Autonomy is giving the patient the option to make their own decisions in their health care. Non-maleficence is doing the patient no harm. Beneficence is benefiting the patient with treatment, and justice is giving all patients fair and equal access to treatment. Medical facilities and healthcare organizations all have a code of ethics, which is a set of values that tell an employee or a member of an organization what they are expected to do when providing patient care. These code of ethics help to ensure that patients and their families, coworkers, employees, and all others in the medical field are treated ethically. After understanding what ethics are, we can talk about some common ethical dilemmas in healthcare. One is patient privacy violations, such as the unnecessary release of patient medical record information to others, and this is becoming more common with the use of electronic medical records. We also have crossing the line between patient-provider relationships, such as when a provider and a patient form a sexual relationship, which is illegal and unethical. There's also fraud and abuse in medical billing that can cost patients and health insurance companies a lot of money. And last, we have bioethical dilemmas such as abortion, stem cell research, and gender reassignment surgery that healthcare providers will come across during their careers. After looking at the common ethical dilemmas, we can also observe a study of 210 medical professionals and whether they have violated core ethical values in the health field, and this can help us to see the need for making good ethical decisions. Here, we can see that the core ethical values of autonomy, beneficence, non-maleficence, and justice are being observed, and at least 40 healthcare providers in each of these categories have violated the ethical value. It's important that these numbers stay at 0 because medical professionals should understand the importance of implementing core ethical values. We come to the question of why should we worry about ethical decision-making in healthcare? But by proper training and utilization of ethical decision-making, we can help to avoid ethical dilemmas as well as avoid the violation of ethical values that we have seen earlier. Patients also depend on healthcare providers for honesty and integrity. Providers should put their opinions and beliefs aside in order to give the patient the best patient care in the patient's best interest. Ethical decisions also take the bias and emotions out of medical decisions that may have a great impact on patient lives, and we're only looking at the facts and circumstances of the ethical dilemma when we're using ethical decision-making. And last, the law is not always enough in order to ensure optimal patient care. By using ethics and ethical decision-making, we're able to supplement the law for the patient to get the best care that they deserve. Now that we understand why ethical decision-making is so important, we can look at some ways how to make ethical decisions. First, we have the 7-step decision-making model. We begin this with gathering information and facts and then deciding what our ethical issue is at hand. Then we're going to come up with the solutions as well as the advantages and disadvantages of each solution. Then we're going to come up with the consequences each solution may have, and then after basing all of our information on that, we're going to pick out the best solution and then implement our solution. Another decision-making model is the Dr. Bernard clinical model, and this is a lot more simple, starting with gathering all of the information, deciding what our ethical issue is, and then deciding on a solution and executing it. While we're making these ethical decisions and using the decision-making models, there are also some other factors to consider. We need to consider the obligations that we have to our patients and their families, our coworkers, employer, our organizations we belong to, society, and our community, as well as ourselves. We want to make sure that the ethical decisions we make are going to be best for everyone. We also need to know who to report to and how to report. For example, if there isn't a case of elderly abuse, we want to make sure we know what state government agencies to report to and what facts we need to have in order to make our report. We also need to learn how to communicate effectively with others who are involved in the decision-making process. We should be calm, polite, and clear with our message, listen to others and their concerns, and include everyone who is involved in the decision-making process. Last, we should also remember to refer back to any codes of ethics through our employer or organizations that we belong to. As healthcare providers, we can follow ethical standards and codes of ethics to help us when we encounter ethical dilemmas. We should base our ethical decisions on ethical principles, the facts and circumstances, and the law. We should also remember to use our decision-making models to help us when making these ethical decisions. Being a healthcare provider is an amazing opportunity to have a great, lasting impact on our community. And now that you know how to make ethical decisions, you can provide exceptional care throughout your healthcare career. So, what steps will you take to make mindful ethical decisions in your healthcare career today? Thank you.